Hello everyone, so welcome back. So the things I just want to discuss here is related to trauma. So whenever the case of trauma is asked, we must see okay if patient have any bleeding disorder, any like the tetanus coverage, head injury, and the radiographs. So mouth guards are like the formed if they are custom made, and then there is root resorption, often result of trauma, and we must know how to differentiate between internal and external root resorption. In case of crown fracture, if it is mentioned that it is uncomplicated, that means the pulp is not involved. And if it is complicated, then pulp is involved. And regarding that, the treatment option will change. So if there is like written that it's in the enamel, then we will smooth the enamel, and if it is enamel and dentin, then we will restore. And if like enamel, dentin, and pulp is involved, we will look for the option like the age of the patient and the apex are formed or not. So then next thing is the root fracture. If there is coronal fragment non-displaced or non-mobile, then no treatment. And if it is displaced and mobile, then we will extract or reposition with the supplant for 4 weeks. What is concussion? So in concussion, there is no displacement or increase in mobility. Primary tooth has sore PTL. So we will ask patient to take soft diet and oral hygiene instruction. Whereas in subluxation, there is no displacement, but there is increase in mobility, and we will say soft diet and oral hygiene instruction. Whereas intrusion, it is like inside. So primary tooth is displaced apically. Can someone be displaced lably? So primary teeth will usually spontaneously. They will ask you in the question like the treatment. So you will say it will automatically after some time it will re-erupt, like it will come out. So we don't need any supplant or something. So it will re-erupt. And in case of extrusion, we have like primary tooth is displaced coronally. So we have to extract the teeth if intruded more than 3 mm and monitor if it is less than 3 mm. If endo is required, we will look for the like the other things. And then we have avulsion. So this is the basically tested too many times. If the tooth is out, we have to note the timing when it is out, and we do not replant the primary teeth. And in case of lateral luxation, the primary tooth is displaced laterally. And in case of alveolar fracture, it is like the bone is fractured. So we reposition and flexible splint for 4 weeks. Remember, it is not rigid, it is flexible. And in case of lateral luxation also, if it is extremely displaced, then extract, otherwise splint for 4 weeks. Thank you.